welcome to Boond Soch की train of thoughts. We are having a series of a discussion with Dr. Sanket Mehta. Sir, welcome again to this show.
Thank you, sir.
Dr. Sanket Mehta is a very well-known name in the country in the field of cytoreductive and HIPEC surgery and the president of the Society of Peritoneal Surface Surgical Oncology of India and director of SSO. So now, in fact, in this episode, we'll talk more in terms of cytoreductive surgery and HIPEC. Like, what is this all about? So there's some clarity for the target audience.
Yes. So, cytoreductive surgery, what the name typically suggests, is removal of all abnormal cells from the abdominal cavity. Typically, it is used for cancers of the GI tract or of the gynecological organs which have spread to the peritoneum. For context, peritoneum is the membrane that lines the inner side of the abdominal cavity, and often GI cancers or gynecological cancers spread to the peritoneum, and they need removal by performing cytoreductive surgery. Mm-hmm. It can be not just removal of one organ like the uterus or the ovaries or the colon, but also removal of multiple organs as a part of the same surgery. The idea of the surgery being that there should be no visible residual disease inside the abdominal cavity at the end of the surgery. Mm-hmm. Sometimes we perform 5 or 6 different oncological procedures as a part of the same surgery to ensure that all the disease is out. Following this, we reconstruct all the organs so that the patient can live a normal life after the surgery. And then comes the role of HIPEC. HIPEC stands for hyperthermic intraperitoneal chemotherapy. Hyperthermic meaning heated, intraperitoneal meaning chemotherapy given directly inside the abdomen for the peritoneal cavity. And this is given in the heated form at 42 to 43 degrees Celsius. Studies have shown that at this temperature range, the intracellular penetration of the chemotherapy increases by 50 to 70 times because it's a logarithmic relation where 1 degree rise in temperature causes a magnitude of increase in the intracellular penetration of the chemotherapy. And that destroys the microscopic disease that is left behind after the surgery. As a combination, cytoreductive surgery and HIPEC are used for treating various types of peritoneal surface malignancies like ovarian cancer, colorectal cancer, even stomach cancer which has spread to the peritoneum. We also use it for rare peritoneal diseases like pseudomyxoma peritonei, which is a tumor of the appendix that is spread to the peritoneal cavity, or mesothelioma, which is a primary tumor of the peritoneum itself, and other rare tumors like urachal cancers, etc. Most of these surgeries need to be concentrated in institutes of excellence or in surgeons with high volume because the learning curve of cytoreductive surgery and HIPEC is close to 120 cases. Which means that if you're doing one surgery a month, it will take you 10 years to overcome your learning curve and to stabilize the results and perform the surgery safely for the patients. We started doing this surgery 15 years back. We are the first dedicated unit to do cytoreductive surgery and HIPEC for peritoneal surface malignancies in India. And over the last 15 years, we have performed more than 3,000 of these surgeries. And now we have an entire team that ensures that the surgery can be performed safely. But the need in India is much greater because we don't have screening programs, and hence a lot of these malignancies, in particular ovarian cancer and pseudomyxoma, are diagnosed very late in the evolution of the disease, and therefore these patients all need this treatment.
Good. Doctor, I'm sure the initiative as an entrepreneur which you have taken in terms of an SSO, that specialty surgical oncology in Mumbai, you have got best of a doctor associated with you. I'm sure since you have conducted more than 3,000 surgeries, and I'm sure as far as the patient which are concerned will be in the safer hand. God bless you in abundance for taking initiatives of opening this particular hospital, and I'm sure the expertise which are there, I think patients will be in a safer hand. Thank you very much. God bless you in abundance. Thank you very much.